Well, here we go. Good morning, good afternoon, good evening to you, wherever you are in the world. I'm really, I'm very excited to be with a vet that has this type of background and experience. And real quick, before I introduce Michelle Tilghman, veterinarian, Dr. Tilghman, I want to just go over real quick a little bit of her CV. She's been operating her practice over 25 years. She's absolutely holistic and has very, very thoughtful, integrative, regenerative treatments. In 2017, she won the Lifetime Achievement Award from the American Academy of Veterinary Medicine. And she's been the president of the AHVMA, which I'm a fan, very big fan. You've served on the board of AAVA and the former chair of the International Education for IVAS. This is exhausting, Michelle. I mean, you're a busy lady. And you're currently on the conference committee for AHVMA. That's right?
Yes, I am.
Great. Certified canine rehabilitation practitioner, which we're going to talk about a little bit today. You're an international educator. You've written many papers, done many lectures, and I also like that your daughter's a vet, so you must have done something right there, your daughter Rosemary. So let's get into some holistic veterinary medicine, shall we?
Sure, we can do that.
All right, great. So it's really a pleasure to have you on. Thank you for being here, and I know you rearranged your schedule to be on today, so thank you. So let's start with my favorite topic, and I want to get into older dogs, rehabilitation, some of the therapies you're seeing that are working. Let's talk just briefly about nutrition. How do you think about nutrition for dogs and cats, Dr. Tilghman?
Nutrition. I mean, if we want to look at Chinese medicine, if we want to look at holistic medicine, wherever you come from, nutrition is so vital because we are what we eat. And to be able to work with geriatrics, muscle atrophy, all the different types of things that we see, we have to provide good nutrition. We have to do the building blocks to repair muscle, to help the organs. So I find that nutrition is very, very important in any of my patients. And I always start my clinical exam, even on a wellness check. What are we eating?
Yeah.
And how are we eating it? And give me some idea of their nutrition, because I find it so important.
Yeah. And how consider to be good nutrition for dogs and cats?
What? Excuse me.
Sure.
Well, I think I got your cough. Considered. Okay, so let's talk about cats in the beginning.
Yeah.
Cats are our obligate carnivores. They are the meat eaters. And I think if you look at teeth, you look at these mouths of these animals, it's pretty easy to determine what they should eat because their teeth are set up for what they should eat. Cats, definitely carnivores. They have the ripping, they have the real spiky type teeth. Dogs are a little bit different. They're kind of omnivoric, where they do meat and they can do veggies. Yeah. And then, of course, you go into your herbivores and your rodents, and they all have the teeth that fits a diet.
Yeah.
So looking at nutrition and making sure these animals are fed properly. I think the proof is, especially in our kitties, that when you look at regular dry food, that it's easy, grocery store brand, but you look at the ingredients, and when the first couple ingredients are green, that is not something to feed to a cat. They need their meat. And the proof is when we have our type 2 diabetic animals, when they come in, the cats are diabetics, and you can reverse it usually reverse it with diet change, with doing meat, high protein diets for the kitties. So just a bad disease like that can be changed so easily. Same with all the, the dogs that I see. One thing I have always promoted, and this is probably through my mama, who raised Cairn Terriers and showed them for a long time, I've always been a proponent of clean, and I call it kitchen food. Not leftovers, not this, but actually cooking for your animal to some extent that you're able to. I always preface the question is, do you cook for yourself? Many people are like, no. I go, do you have a crock pot? Yes. I go, well, we're going to use it now. So teaching people how to at least add fresh cooked meat and veggies to kibble is on some people. And then I have clients on the other end of the spectrum that just would like to feed raw. And I will work with, whatever people are comfortable with. You can't ask a vegan who hates meat to feed their animal raw. It's really hard for them. So you have to meet my clients where they can.
Although I've met some brilliant vegans who do exactly that. They're touching organ meat and everything, and they're gagging while they're doing it. But God bless them, they are doing what is appropriate for the animal.
Yes, and I salute them because most of them hate anything to do with the meat.
Yeah,
especially if they're vegans because of their emotional attachment to animals. But it's a building block. You cannot heal unless you have a really good diet. You cannot build muscle unless you have protein. So I think that you have to look at how do we handle chronic disease. And in Chinese medicine, if we're looking at TCVM, the spleen in the stomach, we always talk about the spleen in the stomach, how important that is because so many disease processes come out of bad digestion.
Yeah.
Hey there, this is Rob Ryan. I just want to say how much we enjoy making this content for you here. And if you are enjoying it, would you like our video down below? And would you subscribe to our YouTube channel? It sure does help us get discovered by more people like you who need information like this. And also down below in our description, the top link is to our trial pack. We hope you'll order one for your dog so your dog can have fermented superfoods that give them nutrition like they can't find anywhere else. Hard to get nutrients that are easily absorbed. Thank you very much. Now back to the show.
There was just somebody on our YouTube channel just today that said that she would like to see, I think she has forgive me, I might be wrong, 12 or even 16-year-old, one of those two numbers is in my head, a cat with kidney disease. And we're thinking this year that we'll come out with a cat product, but we don't really get a lot of cat people. We do our site, but when we do, people ask us, can we feed your dog formula to our cats? My cat, I hear all the time, cats have kidney disease.
Oh,
tell me, what's your philosophy from what you see, all of your experience? What's your philosophy on that, both in why it happens, why it's so prevalent, and then how to address it? Because you kind of addressed the diabetes disease. Let's talk about kidneys.
Okay, well, kidneys. Kidneys, if you think about the kidney, I was so excited to learn kidney physiology from, of course, Dr. Finko at the University of Georgia when I was in school. But the kidneys, let's just talk about kidneys, what they do. Not only do they concentrate our urine, they control your calcium phosphorus ratio, they tell the bone marrow to secrete red blood cells with a hormone called erythropoietin. They are instrumental in blood pressure. So kidneys are vital. And the thing about kidneys is with felines and kidneys is I think that the food that we fed them, especially the dry food, and the fact that they cannot take enough water in causes us problems. Many times I have my kitty people definitely go wet food and actually add a little bit more water. Because of cystitis and urinary problems and kidneys. But in an older cat that has gotten to be 16, 17, 18, and their kidneys start to tank, I tell people actually they've done a really good job of getting this kitty this old. Because when we see the kidneys start to fail, it's like the body has avoided the cancers, has avoided everything. And now our kidneys are starting to give them a hard time. that's when we start to work with different type of diets. Now, the normal way in veterinary medicine, we try to address kidneys, and kidneys is dropping their protein in their food.
Yeah.
Problem with dropping their protein in their food is then I see a lot of kitties, after they've done that for a while, is atrophy. They don't have enough protein for their muscle. So we have to balance that out between lower protein and enough protein for their muscle. Also, most of the kidney diets out there, unfortunately, are not very palatable. They hate them. Cats, think about this. They like meat and they like fat. And if they're going to eat, they want it to taste good.
Yeah.
And usually kitties will only eat something for 3 days and they say, forget this. But we have to keep them alive. So I'm always, we got to feed them. I don't care if this kidney food or what it is, they've got to have the calories. So you have to kind of live on a fine line between protein and too much protein with them. Kidney disease with our dogs, if we even want to look at dogs, we see a good bit of kidney disease in dogs, but I also see it on my older dogs.
Is it? How do you think about organ health in animals? Dogs and cats will focus on. Is it almost like a chi problem? Assuming that they've eaten well, they've eaten biologically appropriate, species appropriate diets most or all of their life. How do you think about those? Do they just have a finite amount of time, just through evolution? Is it more like Chinese in TCVM, traditional Chinese veterinary medicine? Is it like more like the chi is going? How do you think about it?
Well, I think we're all born with X amount of chi and genetics. Okay, we come in with DNA, and that is kind of our genetics is our driver. Then you have environmental. And for whatever is going to be expressed environmentally, that may turn on a cancer gene, may turn on another type of gene throughout a life. But animals, I feel, and I tell people this all the time, that if you have a big dog and you have made it to 14 years old, you have done an amazing job, because they are not programmed to live. I think that 14 years is kind of significant.
Yeah.
And they just don't seem to be able to thrive longer. Now, of course, we have our exceptions. We always have people that live into their hundreds. Yeah. But, in the 80s, 90s, you start to see the downfall of people. Kitties, I would say 15, 16. I've had my own kitty 20 and a half years. But then she had fluids. She was a vet's kitty. Yeah. And we have quite a few kitties that are almost in their 20s, but then you have to watch for hyperthyroidism and everything else and just keep them healthy and hydrated.
Okay.
Because of any of the animals that we have, cats tend to be very young, just kind of like horses, and they always seem to be a little yin deficient. So they tend to be a little bit dehydrated. So it's always good to we're always using fluids and everything else that we can to keep them hydrated, because when they become dehydrated, then they don't want to eat, and it becomes this horrible cycle.
Mm-hmm.
So these animals are just not programmed to live, I think, any more than 15, 16 years old. And it's a hard pill for us to swallow, because unfortunately, we're the only profession that usually sees them when they're babies and have to help put them to sleep when they're old.
It's so true. Yeah, that's a very, very tough reality of being a veterinarian. So let's go back to the older cats with kidney disease. Would you take I've never had a cat, but I was just thinking, if I had let's say that this 15 or 16-year-old cat with kidney disease, assuming it didn't absolutely, hate going to the vet and was tortured by it, because my animals have never been, they love going to the vet. We have great vets, we have great experiences, it's all great. But that would be a lot of stress to put on an older cat. I wouldn't want to do, but let's assume not. Yeah. Would you assume like, would you do like subcutaneous fluid, just come in, get an injection once a week and get out of there in 10 minutes?
Actually, what we do is we teach our owners how to do it at home.
That's great.
And it makes it easier. My technicians and I will, go over it, teach them how to do it, get them comfortable with it. Then always a treaty or a churro afterwards, so that they've, so they actually will not enjoy it, but look forward once they get used to it. So it's a good experience.
Yeah.
Other thing, if you think about this, there is nothing more holistic than fluids.
No.
Fluid. I mean, our body runs on 90% fluid. And to give fluids to flush kidneys, to flush liver, we do fluids after chemotherapy.
Yep.
Is so basic.
Yeah.
The thing that really always has struck me is that more children in third world countries die from dehydration and not having fluids than any other disease. And it's so simple.
Wow. What do you think about my older labs? When I had them, I was doing just for preventative and anti-aging, essentially. I was doing, Myers cocktail, glutathione, IVs, and I'd put a port in them that didn't bother them. I was very comfortable with it, and for like a week, and then we do a couple rounds of therapy, and then we yank it out, and that's it. They had a little shave mark for a bit, but I do it every 6 months, something like that. I have no idea if it worked. I think it did. I saw one of my older dogs. My black lab buddy. He lived to 16, and after he had a pretty serious surgery, being on a hike and getting swallowing a tibia bone that we couldn't find for 6 months, he'd lived with this tibia sitting in his horrible. Finally found it on imaging. Finally, it worked its way through. We had it removed. Pretty serious, not an easy surgery. And I had him hit really hard with IV nutrient therapy, and the vet said, I can't believe how fast this dog's healing. I just can't believe it. So how do you do that in your practice? Any nutrient IV therapies?
We have done IV therapy for definitely for some of the cancers, especially when people have requested it. It takes a lot. It takes, because you have to have an IV in it. They have to stay under watch. So it is labor intensive. I haven't done Myers cocktail in a while. That was a very awesome cocktail we used to use, especially for heart patients. The manganese and everything, and the B12, the B complex. Instead of that, especially with my sub-Q fluids, when I'm doing my kitties or my canines, we make canine vitamin A and feline vitamin.
Love it.
Vitamin C, pantheatinic acid, B12, B complex.
Love it.
And put it in their fluids because it's water soluble. So it's going to make your urine maybe a little pink. And we use it, especially in my kidney patients and in my liver patients, in their fluids all the time.
Fantastic.
So it just helps.
Explain why do we have to go through the trouble of either subcutaneous or IV? Why can't we just give it to them in their food?
Well, a couple reasons is some of it is not absorbable in their food. You have a sick animal and they don't want to eat. It's hard to get food in them, especially a cat. Dog, sometimes you can force feed a little bit. But if we give them let's just talk about B complex vitamins. We give the B complex vitamins in their fluids. When they're sick, usually cats and dogs produce it in their liver. When they're sick, they don't. So B complex drives appetite. Yep. So, and also B12. So by giving it, it helps them eat better, because trying to give it is really hard. Also, B12 is not absorbed well. Most of the time you can do sublingual, but it's much better if it is injectable. Most older animals and people are deficient in B12, and the only way that you can get B12 also is through meat.
Yep.
If you're a big vegetarian, you need to have a source of B12. So trying to put it in their food makes it not as absorbable. And this way, with fluids or an IV, it goes right into the body.
That's great. So do dogs make their own vitamin C, unlike people?
Yeah, guinea pig.
And what?
Guinea pig.
And guinea pigs. Do cats?
Yes, they do. But when they're sick and dehydrated, they don't make very much at all.
Wow, it's so interesting.
Yes, guinea pigs are our misnomer about vitamin C. They have to have vitamin C. Kind of funny.
Yeah, they're
those
guys.
They're funny little guys.
Yeah. And so when the cat is subcutaneous, meaning just under the skin, does a big ball blip on their back?
It makes a little like a hump, like they look like a camel.
Yeah.
And usually within an hour or two, depending upon how dehydrated they are, it will be absorbed immediately. I've had cats I've given like 200 milliliters of fluids, and they're so dehydrated, you're like, where did it go?
It just goes right in.
Right in. And one little needle prick. You think about it.
Amazing.
The benefit from the little bit of pain.
I mean, if you do it right, my dog's never even cared about it, But this is such a underutilized. Unless you have a vet that's advocating for this sort of thing, it's an underutilized. Nobody ever. You hear no one talking about giving subcutaneous fluids. It's the easiest thing in the world. Like, which generally, obviously, it depends on what part of the country you're in. But what are we talking cost-wise to send somebody home with?
Nothing.
No.
Actually, on my chronic guys, we get them to buy the cases of fluids from an online pharmacy.
Yep.
And the Venus sets will write prescription.
Yep.
So I know probably in my practice, a bag of fluids, a Venus set, needles, maybe $50 that will last you a couple weeks.
Wow.
Cost versus benefits too is and then a little bit of vitamins.
Yeah.
Is amazing what that can do.
Oh gosh. I mean, and I just got through being sick. I mentioned to you before we hopped on the camera, and I had a IV folks come to my house and, put a bunch of stuff in me. And I tell you something, it is a miracle how you feel. Like within an hour, I was like, whoa. And I knew I needed to calm down because this was the nutrients we're talking. I still needed to rest and I was ready to do all kinds of things. I was ready to get rocking. Everybody should absolutely, I think, bring this up to their vet. And for a vet, what are you in business for? You're in business to help heal and solve. And you can make a little bit of money. You've got somebody coming into the practice. You can give them the IVs right there or send them home with it. But you're able to solve so much for so little. Like you said, it's a great cost-benefit analysis. Great return.
It's a great return. And even I have found on my cancer patients that are going through chemotherapy, if we do sub-Q fluids like 24 to 48 hours after they have their chemotherapy, it helps, once it works, it helps flushes. Because if you think about chemotherapy, it kills all the fast-growing cells. What has to handle it? Your kidney and your liver. So if we give them some vitamins, we do some sub-Q fluids, it flushes them. You don't have as much of the side effects and they feel better.
Oh my gosh, this is just bringing me back. It's been a while since I've done, I have a 7-year-old now, Labrador, but it's bringing me back to just the miracle of it. All right, so let's get into rehab now. Let's go from IVs to rehab. So you run a rehab clinic also. Tell us, and this is another thing I've done. I've seen firsthand. The biggest thing, and I think the folks like our customers, they don't have a problem with this, but the biggest thing with rehab and IVs is really the time of us to deal with the driving to the vet or with treatment. But I got to say, the actual monetary investment is so worth it And it's just, you got to find the time to regularly just schedule it in. And boy, there's just nothing better than seeing an older animal who's comfortable and content and gently living out their older life, much more happy. And, so let's just talk about all these things that you have at your clinic I've done. So let's talk about what you do at your clinic in terms of like older rehab or maybe not older, maybe the younger,
paralyzed dogs.
Yeah.
So the premise too, I think if people realize that acupuncture is great, it can help restore function. Chiropractic is great. Nutrition is great, but nothing puts on muscle unless you use it. And when the older dogs especially are old, they're in pain, they don't want to get up,
Yep.
They're going to be in the ground really fast. If we don't get them up, we don't get them moving, we don't address their pain. So with everything that we do, trying to decrease their pain, whether it's pharmaceuticals, acupuncture, nutraceuticals, to get them into a rehab program, we are blessed to have an underwater treadmill. So you get an animal in an underwater treadmill, it de-weights them.
Yep.
It's warm, and they're able to move. Paralyzed dogs that can't walk on land, you de-weight them, and you can watch them start to move.
Yes.
So using water, and I always tell people, my dog doesn't like water. I go, well, we're not adding the dog to water. We're adding water to the dog. He said, go in dry, and then we raise it to the level of the joints that we need to work on and get them to walk. And they get treaties. They get peanut butter on the front of the underwater treadmill. Mom's there talking to them, encouraging, but getting them to move again.
Yeah.
So vital for my paralyzed guys and my geriatrics. Then setting them up, and Dr. Kerr is great with this, a home exercise program.
Okay.
So my favorite thing to say is with older guys is when they go on a walk, it's not a walk down the sidewalk. It's a PT walk. It's up over the sidewalk, down the curb. We're going to do a circle this way, a circle that way. We're going to do all these different things because we have to work on nervous system, muscles, proprioception, head-wise, get them feeling better. So ET and rehab is so vital, especially in my geriatric patients.
Yeah.
So we've actually even had a couple cats in the underwater treadmill.
So just to paint the picture, if somebody's never seen one of these, they're usually they remind me of like magician boxes. They're clear. They're clear on all sides. And then the animal in, there's a treadmill below them.
Yes, the treadmill below them.
And then the water rises really slowly and it's warm.
And it's very warm. It's 80 plus degrees. And that being warm enough so that it increases the circulation and it feels good.
Yeah.
And then depending upon where their joint is a problem, you raise that water like a carpus, like the wrist, or up past their elbows or to the point of their shoulder, depending upon what we're working on. And then you're able to regulate the treadmill speed according to the dog and have them work. We also always put them in a life jacket. So we're able to help them. Many times our therapist, Dr. Kara, will get in there with them to encourage them and to be safe with them. So it is it will work their muscle, it works their lungs, it helps their cardio, and it is just a big plexiglass box.
And it tells
them on the bottom.
And honestly, I mean, who knows what the weight is of these benefits, but it's telling their body that they're viable and they're living and they need to keep up, they need to, they're walking, they're part of the living. You probably also don't you have these like kind of cranes for the really severe dogs where like you can support them even beyond a life jacket?
Right. We have like we have help-me-up harnesses for people, but we do have a whole year lift. It's the thing that they use to pick up people. We do pick up animals also. But the cool thing is once they're in water, they float.
They float. Yeah. And then, so doctor, the other thing that is occurring to me is the resistance of the water that they're walking through. So just go into that a little bit, the resistance.
So if you've ever been in the ocean and walked, you will feel the resistance. So it takes X amount of energy to walk, depending upon how fast we're asking them to walk. So it's warm, the resistance, and they're actually like working against that water provides a little bit more resistance and to help them get their muscles back. It's almost like telling their muscles, this is what you have to do. And what we like to do in PT compared to, let's say, the underwater treadmill compared to a pool. Now, whatever people have, I honor, but the underwater treadmill, we have them walking. So it is a closed chain type of exercise.
Yep.
And we need to do PT to emulate exactly what they have to do at home.
Yep.
Go out to the bathroom, go down the stairs. So we like to do that. Now, swimming tends to be up and down, which is a great exercise.
Yep.
But still, you need a lot more with extension to be able to, especially these dogs with bad hips.
Yes. And do you find that do you supplement with anything that's like a muscle builder, like myos or something? Do you use any of that stuff?
Well, always, all the animals that have got joint problems need to be on a type of glucosamine, chondroitin sulfate. And the ones that I like to use usually have digestive enzymes because the glucosamines are huge. They're very hard to digest.
Yeah.
We've actually gone to, especially my chronic dogs, where I have a generic Adequin with hyaluronic acid. We send it home weekly for the people to inject because a lot of times it's hard to get it in orally. We've been working with myos a little bit, had some clients. We definitely check things out, kind of new, to help with build muscle. Myos, for anyone who doesn't know, is the membrane, especially in eggs. Very high protein, very easily to digest. So I also talk about feeding eggs to animals beside the myos.
Yeah.
But that's a good product.
And those are myos is fertilized eggs, which they think is the secret. Yeah.
Okay. Is that I don't know. I didn't know that. Thank you.
Yeah.
So putting together a package, including drugs if we need to, because some of these joints are so bad, you wouldn't walk on them. So putting, anti-inflammatory, glucosamine, exercise, nutrition, trying to get the best package for that animal.
Yeah, amen to that. And then again, not to go back into IVs again, but boy, I'll tell you, you do a couple glutathione IVs, and you just that just extinguishes out the. A veterinarian explained to me that you do the glutathione, it's like the fireman putting out the fire, and then you farrow it with a Myers cocktail, and it's like the construction crew coming in and cleaning up the debris and rebuilding again. I like that visual. And I mean, it's just nice to know that there's all these tools in nutrients that you can use. I mean, it's so cool to be thinking about that. How do you think about green lipid muscle in the scheme of like chondroitin and, glucosamine and all that? Do you supplement with those or?
Well, that is a glucosamine. If you think about green lipid muscle, it's glucosamine, chondroitin.
Yep.
It's a natural source.
Yep.
The problem with all those is it's so hard to digest.
Yeah.
That digestibility. So using a glucosamine and some of the products that definitely have papin in it or boswellia or some of the other also digestive enzymes help push it in.
Yeah.
Do you think green muscle is a muscle? It's a colon.
Yeah.
It's a good source. But the digestibility, I think, is its downfall. So you have to, if you look at the labels on all these, you have to do a loading dose. It's because it's so hard to get it into the body.
Yeah. Yeah. Do you know anything about the green lipid oil? Does that?
No, I don't.
Okay.
That would be interesting. That'd be easier to digest.
Yeah, that's what I'm wondering. I think it needs to be looked into a lot more, but I know it's available, and it's expensive too. That's the other thing that's a challenge, is it's expensive. But you bring up a really good point with the food. The food component is it has to be broken down, and so better to use really good enzymes with it.
Be able to push it into the system.
Yeah. Okay, great. So what other rehabilitation things are your favorite?
Well, definitely balance. So we have the round balls and we have the balance balls, because you have to have good balance. You just think about older people and they talk about falling, and then they just topple.
Yep.
Right? Older dogs are kind of the same way. So by getting their balance, working on balance with some of these balls, we have a balance board. Yep. The other thing is that in PT, we always, again, try to teach them to do things that they have to do at home. So we have little stair steps. So they're going up and down the stairs, teaching them to do that, getting them confident. The other thing about stairs that people don't think about, I just had one on the other day, turn the light on. They can't see. So going down big deck stairs, going down their stairs at night, they don't want to go out. They can't see.
Yep.
You got to turn the lights on. But making sure that they feel comfortable. And also, when we're talking about stairs and we're talking about surfaces, don't let them slip. People, hardwood floors, I'm like, go to Home Depot, get some runners, because that's the worst thing for them. They go right on out and then pulls their adductors and their gluteals. So all our PT, it's like OT also in humans, is done so that they can function better at home.
Yeah. And God, you bring up a really good point, is don't add insult to injury. Don't let them fall.
Yeah, and the slippery, like the hardwoods, people run into new houses, beautiful hardwoods. I say, I'm sorry, you need to have runners. You need to have a mat by their food bowl, their water bowl. Do not let them slide out.
Yeah, you just got to runner the house. I went through that. I had tile and hardwood when I had my older dogs. And I tried boots, and there's no way around it.
Even they have those little pads. They have the little things for the nails. They're all helpful.
Yeah, they are.
The bottom line is you can go to Home Depot and get the runners, and then they'll use their runners, and they'll be much happier.
Yeah. You're so right. Having an injury in an older dog, that's just not. You don't want to go 20 steps backwards.
No, not at all.
Yeah. So. Okay, so anything else that's super, because I've done these, I bought PVC pipes, cones, did used to step over.
Yep, the Cavaletti.
Yeah.
Tab.
I did all that. I'm remembering back to all of that, and it pays off. You're doing it. You're going, how many hours do I have to do this until I see results? You see results really quick.
Pretty quickly. Definitely, Cavalettis are parked now. If you think about, okay, let's just talk a little physiology.
Yeah.
So to be able to go up and down the stairs, you get off the floor, okay, you have to be able to use your quadriceps.
Yeah.
Okay, your quadriceps are the big muscles on the front of your legs. They also come down and make your patella tendon over your knee. So especially ACL dogs, they lose their quads. These older dogs lose their quads. They need these muscles to get off the floor and to go up the stairs.
Yeah.
So getting like a little obstacle course in your backyard, that makes them pick up their legs to work on these quads. Beth Brown, my friend who is a PT center down in the West Coast, she talks about a hose. So take a hose, they have a doggy door where they go out and put it so it's like a serpentine and make them go over the hose every day.
Yeah.
Come back in over the hose. Brilliant.
Easy.
Easy peasy. Because you got to have them so that they can walk.
Yeah.
So that little things like that make such a difference.
It really does. And then what about hamstrings, the opposite? So like, walking uphill and stuff.
Walking up, zigzag up the hill. There you go. to zigzag up the hill. You think about push. So they have to have that push. You have to have that hip extension. And what are they going to lose when they're older? They lose that hip extension, especially their hips hurt. They walk, they kind of stand underneath them. Their tail comes down, and they don't want to extend those legs. So doing things, especially the hill work and doing zigzags. Also, a bigger dog, getting them up on the second stair. So then they work with their psoas and they help use this extension. It's easy with a treat. Let's work on your extension. My favorite is the peanut, which is the peanut physio ball. So it looks like a peanut, and dogs will do it with a cookie. Get over the ball or have a yoga ball and have them work all these hip flexors.
Wait, how is a dog positioned on the ball?
So a dog is front and back. The feet are on the ground.
Okay.
And that ball has a divot in it.
Yeah.
So they fit on that divot and they feel secure. And then the front and the back feet, and then you start to shift them so that they shift and they start to extend their hips.
Wow.
And I have people that buy them for home, and they use them for themselves too.
Sure.
To be able to really work on hip extension.
Oh, that's so cool. How do you feel about, I think I'm saying this right, PEMF pads?
Oh, the pulsed electronic, the microfrequency.
Is that right, PEMF?
Yes, I think that's right. Like the Assisi pad and the different type of pads they have. Yeah. We use them, especially my geriatric kitties. Like I have a nice Assisi pad. That's a company, but it does the magnetic, like the little magnetic frequency.
Wait.
And when I'm giving them their acupuncture treatment, they love it. Yes, it's really good for them. They have the little loops. I think that there is a need for all that. If you can have that at home in between acupuncture treatments, that would be great.
Yeah, that's what I used with my boys. And so lucky to have a vet that at a really good price too, I thought, would come to my home. Because I was doing plenty of, I'll tell you what I was doing in a second with my 14 to 16-year-old lap. I was doing all these things like at your facility that you do. And then he was getting chiro, acupuncture, chiropractic, core laser, and sometimes electro acupuncture. And while he was laying, I bought a PEMF pad. He was laying on the pad getting this done in house. And then he was going to appointments, this was difficult, is 45 minutes away to each way for 1 hour hyperbaric oxygen chamber treatment. And I was doing that twice a week. That's a lot. So I understand where parents are coming from, pet parents. It's been, especially if you have, and I don't have kids. So if you have kids and your busy career, and it's like, whoa, it's a lot. I'm a kitchen sink guy. So when I see something that's a problem, it's a serious problem that I want to conquer, I just throw the sink at it. And so that's what I do with my dogs. It paid off. How do you order, like, in terms of value, if somebody's going, well, I got to make some choices here. I'm going to do 2 of these things, 3 of these things. They might be thinking in their head a number. How do you think about these different therapies?
Well, I will say for my clients, we offer packages so that it tries to help them with the cost, with PT and with acupuncture. Yeah. In my hand, the most effective thing for pain and for older animals is electroacupuncture. Okay. The second thing is physical therapy. Definitely a little chiro, especially if they're having compensation problems and they have a bad limb and they're back and forth with their limping.
You're correcting that.
Yes. And nutrition.
Yeah.
So the big 3, I think, for me would be acupuncture, PT, and nutrition. If I had to choose,
Yep.
and I only had this, because E-stim, electrostimulation with acupuncture, again, in my hands, helps with pain. And, once you can get out of that pain cycle for these guys, then they'll move better, they'll feel better, they'll want to live.
Yeah.
Chronic pain does a lot of bad things.
Nobody wants
them. The chronic pain cycle, you break it. Once you break that chronic pain cycle, then you're able to do a lot of different things, easy things, home, like the PT walks, better nutrition, things that are more cost effective.
Yeah. And I you're reminding me of the stim. I bought one of those. They're really cheap. Stim, with the pads on it, and and then I'd shave. For like the last year of his life, Buddy had shaved spots where the pads would go. They twitch the muscles, and you're building muscle in it, passively. In addition to exercise, you have to exercise, but you're also passively building muscle. I thought that helped him a lot too. And there's so many little things you can do.
Right. And like attention to the trouble with animals, like you just said, you have to shave them.
Yeah.
Because those pads, you can't put them on hair.
Yeah.
That's the problem.
But these things, I hope that people can understand these things are stacking, and you're doing the right things for the right animals in the right situations. And a really great vet like you will say, you know what, this isn't a really good spend of time and money for you. Do these 2 things, these 3 things, and focus you. You can do everything if you're crazy like me, but it's sometimes not always completely necessary. You definitely get a bigger bang for your buck for many, for different things.
Yes, and you have to see the response too.
You must.
You have, do something, and my rule of thumb is let me work on them 3 times. Okay? Acupuncture, like chiropractic, let me do a 3 set. Because I know that if I don't see improvements after 3 times, then I go, what else do I have here? What else is going on here? There is something else that's happening.
Yeah.
So that's something that I have to consider. And that's why when I sell a package, it's only 3.
Yeah.
Because I just know how good it can work, and I have to look a little further if something is wrong, and it does not seem to respond.
Yeah. And then lastly, let's just end on this note.
Okay.
This time has flown by. I mean, I just absolutely love talking about older dogs and cushioning that, that end of their life so it's super comfortable. And their life can be really, really high quality. And of course, we know their energy goes down and they sniff longer on their walks, and they're much more, they're just much more calm. And they can enjoy. I just think about it as, letting them enjoy the comfort and the slowness of their life, and, cushioning that, that descent, that decline. Yeah. Hyperbaric oxygen. When I started doing that for Buddy, it was just coming out that the true value of it might be the creation of stem cells naturally within the body. And he had a degenerative disc problem. He had it for a long time, and I managed that, and he never really saw any problems with it. But that helped with that a lot. And he had a chronic, just completely off the top of my head, he had a chronic, is that called a fistula with that from a foxtail
in his foot?
Yeah,
like a chronic fistula where it kept being open and draining, like a draining tract.
Yeah. So he had that operated on, like, quote unquote, as a low degree, low serious surgery, but he had that. It came back and it came back and it came back, and I'm talking years. I mean, this thing was. And I mean, I'd soaked it, just did everything I could holistically for it. Otherwise, the only thing that cured it towards the end of his life was his hyperbaric oxygen chamber.
Well, I'm a big scuba diver. That is my big hobby. And you think, okay, just think about pressure.
Yep.
So you've got oxygen, okay, and you go under pressure.
Yep.
So it goes into the tissue.
Yes.
So tissues that do not get good perfusion, like the web of a foot, will now get much better perfusion with oxygen than they will without it. So it's kind of a no-brainer. It's just that hyperbaric is hard to do sometimes. It's a little expensive. Wish I had one. But just putting gas under pressure into tissues is like, wow, yes. And you just think about hyperbaric chamber also when people that dive have too much nitrogen, okay? That's what happens in our tissues.
Yep.
Then they put you in a chamber and the oxygen forces out the nitrogen.
Yep.
So the bends, that's what the nickname of that. But that is the cure to get the nitrogen. So it's just giving the body what it needs to heal.
Yeah. And we were talking about the intravenous, this is how I think of things, the intravenous or subcutaneous fluids. What could be more critical to life than oxygen? And a lot of older dogs, they're not oxygenating well, just like older people. You know, we see their blood oxygen levels are just, they lower a little bit. I noticed a lot of energy after our hyperbaric oxygen chamber. And there's I forgot the name of the company, but they make smaller chambers just for pets. And there's also blow-up ones that you can buy that, you know, that folks take a look at it if that's something you think your animal can benefit from. In addition to these great therapies.
And it's good for traumatic brain injuries for people.
Yes.
Especially strokes, traumatic brain injuries, because you need to get what is using the most oxygen in your brain and to be able to get in there and to help push the oxygen into it.
Yeah. Wow. Yeah. I would even use it for if my animal was cognitively declining it's oxygen. It turns out it's a great drug.
What's more holistic than fluids and oxygen?
Amen to that. Dr. Tilghman, this has been so great and fun talking to you about this, and I hope you'll come back and be with us, talk about some more things in holistic medicine, and thanks for making some time today to move around your schedule.
Thank you. It was an honor to be asked, and I hope anything I can do will help multiple animals. I'm willing to do.
Great. Well, thank you everybody for watching. And again, Dr. Tilghman, thanks so much.
Thank you.
Have a great day, everybody. Thanks,
everybody.